Hi, this is Dr. Vishakha Sharma, and today I'm going to talk to you about the strategy for medical science optional. The first message that I want to give you is stop fearing the syllabus. I understand that it is vast, but it is not as vast as whole of MBBS. So once you have decided to take this optional, stop cribbing about the syllabus. The next thing is that if you are still doing your MBBS, stick to standard sources. Follow Robbins for pathology, follow BDC for anatomy, follow KDT for pharmacology, right? Stick to the standard sources or whichever books your college recommends, follow those books, okay? Don't fall in the trap for having some summarized notes or photocopy notes. Stick to standard sources. Second thing is, once you are reading the syllabus, say you are reading physiology, okay? So, for example, CVS, right, refer to the syllabus of UPSC. So there are 2 or 3 topics which are given in CVS. It's, I think, blood pressure, cardiac output, and regulation of cardiovascular functions. Okay, so now you have seen the syllabus for CVS physiology, and now you are going to read from that standard book accordingly. Okay, so you know that this is going to come. Also, along with that, refer to the previous year question. So they are asking what is cardiac output, the regulation of cardiac output, factors regulating cardiac output. They are asking about Frank-Starling law. Okay, so they are asking about long-term regulation of blood pressure, neuroendocrine regulation of blood pressure. So now I've understood that these are the previous year questions that are being asked from this topic, and this is the importance of that topic. And these are the only topics that are being asked from the cardiovascular system. So okay, now I'm going to study these topics properly, and I'm going to make my own handwritten notes from these topics. Okay, having your own handwritten notes with diagrams and flowcharts is going to give you an edge above the others. Okay, and in anatomy, diagrams are indispensable. With every question of anatomy, you have to draw at least one diagram. Okay, in physiology, you have to draw flowcharts. In pathology, you have to draw histology diagrams. Only then you are going to get that 280 to 90 score in medical science optional. Okay, so handwritten notes are the best, and I cannot reiterate this enough. And so we have already discussed, so add as many diagrams and flowcharts, and notes format should also be in the form of UPSC answer writing. That is, have an introduction. So for example, if it's about cardiac output, define cardiac output. Cardiac output is the volume of blood that is being pumped from the heart in 1 minute. The formula is this, stroke volume into heart rate. Okay, so just write that and then cover all the PYQs in the notes and then just add in conclusion to it. So it should be in the format of UPSC answer writing, your notes. So it's easier for you to revise later. And then, you should join a test series for maintaining discipline and also to get a feedback on how you are writing. Okay, it's very important to get the right feedback early on. That will help you get an edge above the others. Okay, so answer writing practice is a must. Don't wait to write perfect answers, that I'm going to write this answer so perfectly that it's going to be better than any answer that anybody has ever written. So don't fall into that trap. Start writing imperfect answers. Okay, and refer to topper answer copies also for more inputs. Okay, and the 3 R's that you have to follow is retain, revise, reproduce. Revision is very important, and revision is all the more important for medical science optional. Okay, so I cannot stress this enough that revision is the key. And that's it from my side. Stay tuned to UPSC RX and follow UPSC RX for more such updates.